Aiden was 1 pound 6 ounces when he was born, so he's teeny tiny. Around 4 months old, I noticed that his head, like the back of it was really flat, and then there was like a triangle point back here. And so I took him to his doctor, and she said that due to the 3 months in the NICU and being on his back so much that's why it was flat, we needed to do more tummy time. By 10 months old, overnight, he had a knot right where his soft spot used to be. So I called the high-risk newborn clinic that we were a part of, and we told him what was going on, and we got an appointment made. That was when he was diagnosed with bilateral corneal craniostenosis.
Craniosynostosis is an abnormal fusion of what are called the cranial sutures. The cranial sutures are the spaces in between the skull plates. What happens as your brain grows and expands is that space continues to expand out, and then bone will eventually fill in. It's one of the reasons that all babies are born with soft spots. That space, unfortunately, in certain kids is fused early, and in those situations what happens is the brain pushes in any way it possibly can to grow out. If left untreated, there are studies that show that it can cause issues associated with neurodevelopment and neurocognition, and it's one of the reasons why we want to operate on them early, is to give their brain the most potential for growth.
At 13 months old, we sent him in for a distraction surgery. And there was 4 screws that came out along his head here, and I turned them 3 times a day, and it would expand the back of his head 1 millimeter a day. And we did that for a month and a half. We did his second surgery where they took in and they removed the distractors, and they reconstructed the entire front of his face. They have to reconstruct the eye sockets, the nose, the cheekbones, and the eyebrows. Everything was going really great. We were starting to meet milestones. He finally learned to walk. And then about 2 years old, he kind of started to show signs that maybe something was going on. So at 26 months, we met Dr. Mehta, and we fell in love that day. He was absolutely amazing. He sent us for CTs, and we learned that day we were gonna need multiple more surgeries because he had multiple sutures refuse.
10 to 15% of patients with craniosynostosis may need repeat surgery, whether that's because of reoccurrence of pressure on the brain or because there are bony gaps that haven't quite healed in. What's important to remember is once craniosynostosis is diagnosed, we can take care of kids at almost any age associated with that.
Dr. Mehta did his 3rd skull surgery and our 1st with him, and we had our 2nd set of distractors placed. He had a defect right here. There was a hole where there was no bone at all. So Dr. Mehta went in and removed the distractors and filled in that hole.
Families want the best for their kids, and sometimes when they see them in that immediate post-operative period, it seems really scary, but what we really stress to families is that we do a really good job of pain control and pain management for our patients. And even though they look swollen, one thing I tell families all the time is it gets better. Their swelling peaks at about 2 to 3 days. And then what's really interesting is most times by 2 weeks, families have basically told us that they've kind of forgotten that they've had surgery and that they're back to their normal selves.
Aiden is finally talking. He was nonverbal before that. So to hear him say mama and dada is like amazing. He's picking up on his milestones, running like crazy. He's actually up and playing with his brother, whereas before he was sleeping a lot. ACH has been absolutely amazing. Not only our neuro department and plastics department, but every single department we've dealt with have just been truly amazing and went above and beyond to make sure that we're comfortable, to make sure he's comfortable, and they all work really well together to give him the best care.